My next guest is Dr. Katrina Armstrong, Physician-in-Chief of the Department of Medicine at the Massachusetts General Hospital, a leading research hospital. She is also a professor at Harvard Medical School, an investigator and thought leader in areas of cancer prevention, healthcare delivery innovation, genomics, and diversity and inclusion. Welcome, Dr. Armstrong. Thank you so much for being here today.
Thank you for having me. I'm delighted to be here.
Well, we're delighted to have you. To start off with, it's interesting looking at the healthcare field today because we've obviously been through this just huge global pandemic that has, completely upended our lives, but especially the healthcare field. Where does the healthcare field, and I know this is a very broad question, but where do they go from here? And this might seem obvious, but what parts of the field have been maybe most impacted by COVID-19?
With the recognition that the one thing we can't predict is the future, I will say that when I think about the healthcare field, I've lived forever in what we call the iron triangle of healthcare. How do we maximize access? How do we maximize quality while maximizing value or minimizing cost? And my sense is all three of those areas have been transformed over the last year, but honestly, we're poised for transformation. I think you've already talked about access and what's going to happen with telehealth and the fact that we're moving. I really think we are moving from a model of bricks and mortar healthcare, almost like we saw with what happened with stores, to a model of internet and digitally based healthcare. And the question is just how far can this go while retaining that human contact that is so important for our healthcare relationships? When quality, we think about quality for a long time in healthcare was really about process and how did we try to make sure that groups of people got a certain type of treatment or prevention. And that has been transformed really by the scientific revolution that drove both our ability to create vaccines that you've seen, but it's changed our ability to treat diseases, cancer, diabetes, kidney disease. And so we're poised in the future, not too far, to have treatments that are completely different than we've ever seen. And those are going to be individualized. They're personalized to each patient. And I think the question is, how do we get those to people to really experience the benefits of that investment in science? And then I will tell you, cost is a big black box. We've seen for a long time healthcare costs rising, the steady 4.5% over years. COVID changed our ability to understand that we can actually change that cost. We had dramatic changes as we saw in expenditures. Low value care went away, and at times that we never thought it would change as dramatically. So I think the cost question is a big one for the US, has been for a long time. Are we going to be able to change that trend, or are we going to continue to see it grow to the 20-25% of GDP that people were expecting before COVID-19?
Cost is certainly important and something we're definitely keeping an eye on. The next question is actually from one of our audience members, so I'll let them take it away.
My questions today are regarding the role of universities in the breakthroughs and innovations that we see in healthcare. Has that role changed over time? Has it increased, decreased? And also, are there advantages or challenges in working with universities to get their research transferred into industry in order to create those innovations? Thank you.
So I think it's such a great question. Universities, one of the things I think is often poorly understood is the incredible role that universities and academic medical institutions play in driving this revolution in healthcare. Thought it was great to hear about how the prior speakers' current leadership and the project that is going on came out of an academic institution's desire to improve a problem. And I think if you look at the role of universities and basic fundamental science at those universities, it has driven an increasing proportion of our both healthcare innovations, of new treatments, of our ability to actually think about keeping the population healthy. The most classic examples obviously are what are the new vaccines for COVID-19 that are using this mRNA-based technology, that there have been so many great stories written about where that started, how that grew out of universities. And I would say that over my experience in the 30 years I've now been in academic medicine, so university-based medicine, there's been tremendous progress in getting those discoveries into actual practice through this partnership with the private sector, by the ability to actually translate those technologies both into new companies and into new products that are working with existing companies. And so I think we've made a huge amount of progress on this. But COVID-19, I hope that there is one other message from COVID-19. It's that our investment in science and in universities in this country over the last 50 years has been fundamental to getting us to the point of having a vaccine, of looking forward to restarting the economy, to getting this country back.
It's definitely something we're hoping for in terms of going forward and getting the country back post-COVID. I want to move to, pivot a bit to the areas of cancer and Alzheimer's. And I know this is something you've worked with. Could you talk about, any innovations in gene therapy specifically in terms of the treatment of those two diseases?
Well, so I think you make a really great point that even as we talk about changing healthcare, that the fundamentals are still pretty similar. We're managing chronic disease, growing aging population, cancer becoming one of the greatest demands upon our healthcare system. And so, yes, I just want to emphasize that there's still an enormous, even as we move to COVID-19, there's still an enormous amount that's being done in those diseases. So the primary revolution that's happened in cancer over the last several years has actually been how to move from a genomics-based area to an immunology revolution. And so cancer has been transformed by the development of immunotherapy that has actually led to long-term remission and even cures in diseases that we never expected to see. So that has dramatically changed where we're headed in cancer. And gene therapy plays a role in that. And I think will continue to grow as we think about some specialized cancers. But the magic right now in cancer is in immunotherapy. In Alzheimer's and in other chronic neurological conditions, we are moving forward on an increasing platform of therapies that may eventually use these cell-based and other types of gene-based therapies that can try to change the outcomes. Alzheimer's has proven a really tough nut to crack. And so even though we have these new technologies, we're still probably, I'm going to guess 10 years away from seeing really substantial changes coming from them in how we treat those diseases.
Absolutely, absolutely. And finally, as we wrap up here, just wanted to ask really what you think policymakers can do to really spur medical innovations going forward in a post-COVID world.
So I think my sense is that there's three key pieces here. So the first is, and I talk a lot about this, that we have to keep our eye on the workforce. So these innovations come because young people love science. They go into medicine and then they pursue a career driven by trying to make a difference in a disease. So if I were in a policy making position, I would want to make sure that I was making it possible and supporting the educational pipeline in science. It is absolutely critical right now for this country as we move forward. I think the second issue is we've got to keep our eye on the ability to advance these new technologies, to put money into research at NIH, to other areas that actually moves the idea into an actual product or a target that can be moved forward. And I'm going to say, if I think the big next challenge for us is really the challenge of equity. So we are creating new ideas, new science, but they're not reaching everybody. And for the policy question, how do we in this country today learn from the equity issues that existed during COVID and have existed for so long to make sure that these advances reach everybody and have the type of impact they truly can.
Right, absolutely. Well, Dr. Armstrong, thank you so much for joining us and for all of your insight. I appreciate that.
Thanks so much for having me. Have a great day.